rules for you. We have an excellent presenter that flew in from halfway across the United States. So he's pretty excited and fired up about this information and ready to give it to you today. So hopefully you have some questions for us. You are allowed to type in your questions during the presentation, but we're going to answer all questions at the end of today's webinar. So I just want to say thank you for taking time out of your busy day to join us for today's webinar. We do have the honor and pleasure of having Nora Chavez with us, the director of the CHILD program. So she's going to introduce our speaker today. I'm going to turn it over to her at this moment.
Thank you, Leon. So good morning, everyone. Today we're going to have a training on HIPAA. Some of you are already have already received trainings like this before from us, but there are new HIPAA rules that are called the omnibus rules, and those rules are changing the scope of liability, and that may have an impact on your work and our work. The potential liability now under the omnibus rule now spreads, requiring that not only you, but anyone also who you contract with for services related to CHA. For example, like a technician to do work on your database, on the database on your organization, something like that, must comply with HIPAA and the same as you. So to explain these changes, we have invited Jonathan Soames, who's a healthcare attorney practicing in a law firm in the Kansas City area. He's a national expert on HIPAA. He's the president of EMR Legal Incorporated, which provides HIPAA consulting nationwide, and of Veterans Press, which publishes HIPAA compliance materials, which include a book and books and training videos that you may be interested in consulting. Jonathan has litigated hundreds of cases related to healthcare, and we have his information available to anyone who wants to reach out to him after this presentation at any time in the future. Okay? So now I leave you guys with John.
Thank you. We're going to start out with an introduction, just kind of bring you up to speed on HIPAA in general before we get into these high-tech and omnibus changes. The High-Tech Act is that portion of the stimulus package that came out in 2009 that relates to health information. And it strengthened the enforcement of HIPAA. It gave patients and clients some new rights, and it also provides incentives for automating, for adopting an electronic health record. The omnibus rule then is the Health and Human Services regulation that implemented the changes in the High-Tech Act. We're going to start with the privacy rule, because really the heart of HIPAA is individual rights. It also has obviously security measures, but I think the thing that's most important is ensuring that clients are afforded their privacy rights. These rights taken together tend to be more comprehensive than any existing state law. The rights include a right of access, the right to inspect and copy one's records. And this is a pretty broad right. There are a couple of situations in which you can deny access, such as if you got the information under a promise of confidentiality, or the access would be reasonably likely to endanger the life or physical safety of your client or someone else. There's a right to an accounting, which is where if the patient or client requests it, you have to give them a report of who accessed their data, why did they access it, what did they do with it. Notice of information practices, sometimes called a notice of privacy practices, tells them about their rights and how you're going to use the information about them. Right to request restriction. They can ask you not to use their information in a certain way or not to disclose it to a particular party. and with but one exception, it's up to you whether to grant that restriction or not. And the restriction is probably that you have to grant is probably not one that you're going to run into. Right to alternate communications is important. The client has a right to request that they be communicated with in a certain way. And you may already ask, how may we contact you? And that's actually going further than HIPAA requires. HIPAA doesn't require you to ask. HIPAA puts the burden on the client to tell you if they want alternate communications, but there's absolutely nothing wrong with going further than HIPAA requires and asking them, how do you want us to contact you? But in that regard, I'd like to mention the case of Randy A.J., parentheses anonymous. They kept her middle initial and her last name confidential to protect her privacy, versus the Long Island Surgery Center. And she asked the Surgery Center not to call her at home, but only to call her on her cell. And they called at home and discussed her case with her mother, and that caused a horrendous family fight. And so she sued the Long Island Surgery Center and won $300,000 in exemplary damages. Many states they're called punitive damages, damages to punish. New York calls them exemplary damages, make an example out of you. But it's the same concept. So obviously New York law, not just the federal law, recognizes that if you're asked not to use a particular method of communication, you ought to try real hard to honor that right. Right to request correction or amendment. The client has a right to ask you to correct or amend their data if it's inaccurate. You do not have to do it if you didn't create the document. If it's some third-party document that you have in your case file, you can't correct it because you didn't create it. It's not your opinion. It's not your recitation of the facts. It's somebody else's. And the other situation in which you don't have to correct it is if it's correct, if it's accurate and complete. But in that regard, under HIPAA, the client has a right to file a statement of disagreement with your decision not to make the correction, and that's their protection, that they can at least get their side of the story out, that there is a dispute over the accuracy of the data you have. So those are the individual rights in a nutshell. What does all this mean to you? Well, simply stated, you've got to follow the HIPAA privacy and security rules to protect your clients, your organization, and yourself. And obviously, protecting your clients is the most important. And if you protect your clients, you're also protecting your organization from any HIPAA penalties, and we'll talk about them a little later, and yourself. In some ways, the rules are complicated, but in others, they're just common sense. It's just common sense if you have inaccurate data and the patient wants you to correct it, to go ahead and do so. You almost don't need HIPAA to tell you that. Some of the security rules are largely common sense, and I'm going to talk about them when we get to some myths about HIPAA. As far as common sense, all you got to do is put this in your own personal context. You know what about your personal information you wouldn't want improperly disclosed or that wouldn't be safeguarded. You also have to undergo required HIPAA training, which you're satisfying today, and you should keep a record of everyone that's at this webinar. And then you've got to follow HIPAA's policies and procedures. So boiling that down, following HIPAA policies and procedures, what's a simple way to state that? Well, there's really two types of health information that HIPAA covers. And one is what we call data at rest. PHI is the acronym for Protected Health Information, and it's the information that you have to protect under HIPAA. And PHI at rest is a paper record lying on your desk or data on the hard drive of your laptop. So that basically means you don't want to leave documents lying around unsecured. You don't want to leave data on your computer screen when you leave your workstation, and you don't want to lose your PDA or cell phone or laptop or portable hard drive if it's got protected health information stored on it. The next thing is to safeguard PHI in motion. You don't want to lose these portable devices, media, or paper records by, for example, leaving them on the subway. A worker at Massachusetts General Hospital took financial records home that had patient names, Social Security numbers, Medicare numbers, personal insurance numbers, not in a locked briefcase, just secured with a rubber band. And she left it on the subway. It still has not been recovered, and consequently Massachusetts General Hospital was fined $1 million for not having trained her in safeguarding paper records in motion, in transit outside the organization, and for not having a work-at-home policy. We in the HIPAA business call this the $1 million subway ride. And I don't know about any of you, but I do not have $1 million to spend on public transportation, and I doubt many of you do either. You know, and getting back to common sense, observe the need to know rule. If you don't need to look at that particular data, don't do it. Don't go, oh, I know this person, I wonder what's going on in their case, when you have no responsibility for that particular client. There is a doctor at UCLA Health System who was sentenced to 4 months in federal prison for looking at Leonardo DiCaprio's chart and Barbara Walters' chart just out of curiosity. Now, he didn't do anything evil with the information. He didn't try to sell it to the National Enquirer. He didn't try to commit identity theft. He just looked at it and was sentenced to federal prison. He did not have a need to know Leonardo DiCaprio's health issues. Remember that loose lips cause more breaches than hackers, thieves, or anything else. 85 to 90% of breaches of confidentiality do not result from poor physical security. Your lock wasn't good enough. Nor result from poor technical security. Your firewall wasn't good enough. But actually result from the human factor, poor personnel or workforce security. I could go on all day with horror stories of loose lips. Some loose lips caused an attempted suicide when a person was told as a joke by a healthcare worker that she had AIDS when she didn't. And the poor woman tried to commit suicide when she got that word. Another case I'm aware of, a nurse went up to a group of people at a party, and she saw one of her patients in the group, and she walks up to the group and says, oh, Jane, whatever her name was, I'll just pick Jane out of the air. Jane, I didn't know you were going to be at this party. Has your genital herpes cleared up? This did not amuse Jane. And I know none of you are going to do something that stupid, but you got to make sure that you do the personnel security so when you hire a new employee, they're clued in, you know, that you got to keep your mouth shut. And again, you use good common sense. If it doesn't feel right to you, it probably isn't right. So here's the privacy rule in general. You can't use or disclose except as the rule provides. Under the privacy rule, as it's been changed over the years, You now may use protected health information anytime the individual authorizes it. If I'm dumb enough to give you a signed authorization that you can put my health problems up on every billboard in the city, you could legally do that. Now, it might not be a wise business decision, as potential clients might go, well, why are you putting this information up all over the place on one of your clients? But it would be legal to do so if I had authorized it. You may use PHI for treatment, payment, and healthcare operations purposes without the patient's signed consent or authorization. The business calls this TPO. So this is what would allow you to talk about a case with another caseworker if you had some kind of issue that you needed to flesh out with somebody who perhaps knows more about that area of your operations than you do. So you wouldn't have to contact the client and get a signed consent to discuss their case with another caseworker. Healthcare operations are things like quality assurance, peer review, auditing, and the like. Public and public policy purposes, HIPAA allows, like the health department, to audit activity, like is the reimbursement proper? Is somebody, what we call upcoding, signing a code that gets them a bigger reimbursement? Of course, this wouldn't apply to you guys, but as an example, perform one service and then assign a code that gets more money. So health departments tend to audit for those things. And when required by law, it would be fairly stupid to have to get the patient's or client's signed authorization to do mandatory child abuse reporting. So things like that that are required by law, you do not have to get the individual's consent or authorization. The privacy rule applies to basically the same entities as the rest of HIPAA does, like the security rule. Health plans, healthcare clearinghouses, and healthcare providers who maintain or transmit health information in a transaction covered by HIPAA in electronic format. Those transactions are primarily, but not exclusively, billing transactions, like first report of injury, healthcare remittance advice, eligibility inquiries, and the like. But where this can apply to you is one of the high-tech and omnibus rule changes is they made HIPAA applicable to business associates directly. A business associate is a person who provides a service other than the provision of health care to another business associate or to a covered entity. A outside transcription service is the classic example, but it could be a billing company, it could be a medical marketing company. I have a business associate client in California that does pretty much the same thing that you guys do. They get funds for indigent patients, and they're a business associate of the hospitals that hire them to go out and find funds so the indigent can get treatment. The privacy rule applies to all protected health information, paper, oral, electronic. They basically say it applies to all protected health information, quote, regardless of form or format. The security rule, by its terms, only applies to electronic protected health information. But the privacy rule also has a security component to it. So that's why you have to safeguard your paper records and can't leave them on the subway or leave them out on your desk unattended when there's clients or others in the area. Besides those patient rights I talked about, the privacy rule contains duties. So covered entities, and when I say covered entities for the rest of this talk, I'm including business associates because they now have to do everything covered entities do. You got to have a privacy officer. No particular credentials are required. It's just who you think can do the best job. Privacy training program, both initial training when somebody joins your workforce, and workforce is very broadly defined. We're way past employees here. Independent contractors, volunteers, students. If they're going to have access to protected health information, then they have to have the initial HIPAA training, and then your entire workforce has to have periodic refresher training in privacy. They don't define how often periodic is. They let you decide that. I tend to think it should be at least annually that you do a little privacy refresher training. You know, because the rules may have changed. You might have had an incident that you want to brief people on so they don't do the same dumb thing. And even if everything's gone perfectly, I think it's pretty helpful to say, okay, guys, really appreciate the good job you've done protecting client privacy, but let's not get overconfident. Let's keep it up. Here's the language I mentioned previously that requires you to protect all of your PHI, not just the electronic, but that's all the guidance they give you is to implement safeguards to protect health information from misuse. Now, what I do with my clients, and I've had federal government clients, the people who put out the regs, like this approach, so it's kind of been impliedly approved, is I use the principles of the security rule where applicable for paper records. How's the harm any different if you throw away paper records in a dumpster or you throw away the hard drive in a dumpster with the same information on it? In fact, I think if you throw away the paper records, that's probably a worse breach because now anybody can immediately read them. You don't have to be computer literate enough to recover data off an abandoned hard drive. CVS Pharmacy was fined $1.5 million for throwing prescription bottles and the paper prescriptions away in a dumpster. So that goes back, those are paper records, but the security rule has a destruction requirement. So I use that principle. Yeah, the security rule only applies to the proper destruction of your electronic data, but I'm going to use that principle and properly dispose of my paper records by shredding or whatever. You got to have a complaint system. Quite often the privacy officer is the complaint person. If you've got some type of ombudsman or other person that receives complaints and you want them to get the HIPAA complaints too, that's perfectly acceptable. Again, it's who can do it best for you. And then a sanction system. Sanction policies, nothing more than a statement of progressive discipline for HIPAA violations, verbal warning, written reprimand, suspension of access privileges, suspension from employment, termination of employment, in an inappropriate case, referral to law enforcement or professional licensure or disciplinary authorities, where you select a sanction based on the past record of the offender and the seriousness of the offense. When HIPAA first came out, there was a lot of what I call knee-jerk reaction to HIPAA violations. Oh, they forgot to log off. That's a HIPAA violation. Fire them. Well, that may be a violation of a HIPAA policy. But if no unauthorized person saw what was on the screen, it wasn't a breach of confidentiality. It was just the violation of your rule requiring them to log off. I don't think that that's worth firing somebody over unless they keep doing it over and over. So if they've been a good employee and no harm was done, I just think that would be the level of a verbal warning. Hey, our policy is you got to log off when you leave the workstation. Don't forget again or I'm going to have to get more serious. Because if you fire everybody that does any minor thing, you're devaluing, if you will, the serious breaches. Now the person that talks about a client's genital herpes at a party is getting the same penalty as somebody who forgets to log off. The sanction system is very important. It is the single best way to avoid liability for HIPAA violations. You are enforcing your policies. I had a prosecutor at the Department of Justice tell me that they're more likely to prosecute someone who doesn't enforce their policies. His exact words were, don't show us a bunch of policies that aren't worth the paper that they're written on, because you're not enforcing them. That's what's going to make us mad, and that's going to make us more likely to prosecute when there's a serious HIPAA crime committed. Now we're going to talk briefly about the security rule. It has 5 categories, and remember, it only applies by its terms to your electronic health information. Although, as I said, I use its principles to give me some guidance in how to protect paper records and oral communications where it makes sense. Obviously, encryption is going to be fairly difficult with paper records. I'm not saying you couldn't do some kind of substitution code, but it would be pretty hard to deal with. So our 5 categories are the general rules, the administrative safeguards. When HIPAA first came out, people thought it was 90% technical. It's only about 10% technical. It's 90% process, controlling behavior by policies and procedures. There are more administrative safeguards than there are physical and technical put together. Then the 4th category, or the 5th category after the technical safeguards, is the documentation requirement. Simply stated, for HIPAA, if it's not written, it's not. If Massachusetts General had tried to avoid the $1 million fine by saying, hey, we have a policy on working at home, so you can't fine us for not having one, and the Office for Civil Rights Investigator would have then said, okay, show me the policy. And if they had said, well, you can't show it to you, it's not written, it's just our policy, they would have still gotten fined. If it's not written, it's not. Now, each of these 5 categories has what's known as standards. And you've got to comply with all the standards. Most standards have what they call implementation specifications. And they're guidance on how to meet the standard. They have 2 types: required implementation specifications that you have to do. Having a sanction policy is a required implementation specification. You are in violation of HIPAA if you didn't do it. The other type is called addressable, which you have to address, in other words, decide whether you need to do it or not. Well, how do you do that? You ask yourself, is this addressable specification reasonable and appropriate in its environment? In other words, in your situation, with reference to, is it going to actually do something to protect the data? And if it is reasonable and appropriate, then it becomes required. If it's not reasonable and appropriate, then you have 2 other choices. Implement an equivalent alternate measure, or you don't do anything because it's not reasonable and appropriate to do anything. A audiology and speech pathology school in New England was just fined $1.5 million because they lost a number of laptops that they hadn't encrypted. Encryption is addressable, so they didn't have to encrypt them, but they didn't go through this drill of saying, is it reasonable and appropriate to encrypt them, and if it's not, should we do an equivalent alternate measure like password protect them or put a low jack device in so we can locate it if it goes missing. And they didn't write that up. Because remember, for HIPAA, if it's not written, it's not. So that cost them the $1.5 million fine. So here's the first category, the general provisions. You got to ensure confidentiality, integrity, in other words, the data is accurate, and availability of your electronic PHI. And the next one's kind of important. You got to protect against reasonably anticipated threats or hazards to security or integrity. You don't have to protect against all risks. You only have to protect against those that are likely to happen, like a bad storm causes a power outage and your electronic health record won't work. You don't necessarily have to protect against an asteroid hitting your building, because what's the chances of that? You got to protect against uses or disclosures not permitted by the privacy rule. You've got to ensure compliance with all the HIPAA rules by your workforce. And remember that workforce is more than employees. Students, volunteers, independent contractors. The rule applies to all electronic protected health information regardless of its format. HIPAA has defined electronic transmission so broadly that removing a flash memory device from one laptop and inserting it in another qualifies as an electronic transmission, even though I'd say it's the physical movement of media. And it applies to both internal and external communications. If you've got that intranet, it applies just as much to that as if you use the internet. Now, that doesn't mean you're necessarily going to have to put as much security on an intranet, because it might be much more secure than using the internet. But it still is covered by HIPAA, and you have to decide what, if any, security we've got to put on internal communications and what, if any, we have to put on external communications. So I already mentioned that you got to comply with the standards, that implementation specifications tell you how to do that. You got to comply with all required implementation specifications and go through that little drill I just talked about. And here it is on a slide, so you'll have access to it. If it's reasonable and appropriate, then it becomes required. If not, you document why it isn't reasonable and appropriate and why you're doing what you're doing, even if that's doing nothing. Automatic log off after a predetermined period of time is addressable. Well, if the workstation is in a secure room that nobody in the history of man has ever gotten into, that was unauthorized to see what was on the screen, you maybe don't even need a screensaver. And I had one client like that, and it was actually a maximum security institution for the criminally insane, and there was no earthly way anybody was going to get in to the health aspect of that institution to see what was on the screen. It's not going to happen. So they didn't even need a password-protected screensaver as an equivalent alternate measure. Here's the administrative safeguards. You've got to have a security management process, and that's where you must do a risk analysis. Using a sanction policy and doing a risk analysis are the two most important things for HIPAA compliance. Risk analysis is nothing more than the process of selecting reasonable, cost-effective security measures by balancing the cost of the security measure against the harm that would occur if that security measure was not in place. It also requires you to do what's called Information System Activity Review, which is just a fancy name for auditing. For example, you may want to audit it to the extent you've got electronic records for improper access. And that doesn't mean you have to audit every access. Rather, you decide how much auditing do I need to do to deter improper access, and failing deterrence to detect it so that I can take action and deter the next one. Maybe that's only auditing 10% of access quarterly. The factors you consider on how much auditing you have to do is, have you been having problems with improper access? If you see a health system where that doctor went to jail for accessing the celebrities charts, if they're not doing major auditing of celebrity access, their next fine isn't going to be the $865,000 fine they got for allowing that doctor to do that. It's going to be 7 figures. So they should be doing an awful lot of auditing. You may not need to do so much if you haven't had problems with improper access. The second variable is how sensitive is the data. And in that regard, remember that HIPAA doesn't just protect clinical data. It protects financial, demographic, and lifestyle information as well. And that data may be more at risk than the clinical. If I was a criminal and I broke into a psychologist's office, I don't really care if this person I don't know from Adam has been diagnosed with bipolar disorder. I want that person's Social Security number and Medicare number and home address so I can commit identity theft. So even though the psychological data may be even more sensitive, the financial and demographic data may be more at risk. We'll talk about it later, but HIPAA is actually a criminal law. And over 80% of the more than 30 HIPAA criminal convictions to date have been misuse of protected health information to commit identity theft. The security management process is also where the sanction policy is required that we talked about earlier. Assigned security responsibility, you've got to have a security officer. Again, no particular credentials is required. If you've got somebody with a good technical background, that probably would be a good choice. Workforce security. This is nothing more than ensuring that people who need access to your information have it, and those who don't need it don't have it. It has a number of implementation specifications, most of which are addressable. For example, formal access policies are addressable. If you just have one type of workforce member and they all need the same access, well, maybe you don't need an access policy. If you've got various categories of workforce members, all with different needs for different types of access, well, maybe you need to write that down in a policy. Workforce clearance procedure, it comes under workforce security, and it's also addressable. If you're doing some kind of clearance to hire a person, that may be enough to give them access. But if so, you got to write it down. The employment clearance process is also the HIPAA clearance process. Because remember, for HIPAA, if it's not written, it's not. We were just talking yesterday up here about volunteers. Should they be screened? And generally speaking, my thought on volunteers is that they're good people who are giving up their time and effort to help out in some capacity, so they're probably not a real high-risk group. But I always commend to my clients to self-clear. In other words, on the confidentiality pledge that they should be signing, it has up at the top, I certify that I have no felony convictions or any conviction, felony or misdemeanor, involving dishonesty, and know of no reason why I could not be trusted with confidential health information. Now, that's a very minimal level of screening. They could, I suppose, lie and check that they didn't have a felony conviction when they did, but it's a low-risk group. You may not have the funds to pay for a criminal background check for every volunteer. And remember our definition of risk analysis: cost-effective security measures. And so I think that one's pretty cost-effective. Another thing in workforce security that is required is training. Training is so important because it is so visible. You've either got the training records or you don't. A cancer center in Washington State avoided any type of fine or other penalty when an employee committed identity theft because they were able to show that they'd properly trained him and he'd signed the confidentiality pledge and he just did something extremely evil. So he was liable. In fact, he went to federal prison, but they didn't fine the organization where he worked because they had properly trained him. There's a defense to a HIPAA violation called unavoidable employee misconduct. And that's where you got the policies in place, you enforce them, you've trained the employee, and they just do something evil or stupid. Well, you cannot prevent all crime, cannot be done, but you can make it difficult for them, and you can certainly make it into an atmosphere where they know that they'd better not play fast and loose with your health information. So training is very important. I'm not going to go into it in great detail, but workforce security also requires that you properly handle security incidents. A security incident may or may not be a breach. If you fax a document to the wrong office, HIPAA does not define that as a breach unless the receiving office further discloses it improperly. So it's a security incident, and then when you investigate it, you will learn whether it was a breach or not. If that gaining office calls you up and says, hey, we got this fax by mistake, do you want me to shred it, or do you want me to put it in a sealed envelope and send it back to you? Well, now you know that nothing evil is going to result from that missent fax, so it is not a breach. But you still have investigated it because you have to investigate incidents. It was an incident. And your report will conclude with, it was not a breach, therefore no further action is required. Or you may even say, it wasn't a breach, but to be safe, we're going to, at the next periodic refresher training, remind people to be careful and make sure they verify the fax number before they send a fax containing this sensitive information. Information access management, again, just goes back to access policies. One of them that I haven't mentioned so far is the termination procedure. When somebody leaves the workforce or changes jobs so they no longer need access, how does that happen? What events trigger the termination procedure? Resignation, retirement, change of duties, getting fired. Some of my clients will cancel access on extended absences like maternity leave or sabbatical. And it's not a punishment. Hey, we're canceling your password because you're going on maternity leave. It is not a punishment. It is a security measure. And when they return from leave, they get their access back. Contingency plans. I mean, this is just common sense. Backing up your data so that if your hard drive crashes, you've got the data somewhere else. I mean, that's just good common sense. You don't need HIPAA to tell you to back up your data. Business associate contracts. Again, a business associate is a person or organization that provides a service other than the provision of health care that it has to use individually identifiable health information. And we're going to talk about all the changes in the business associate contracts in a few minutes. Here's the physical safeguards, and you see there's far fewer of them than the administrative. Access controls. Do you lock your doors? Do people have to have a card key to get in? Do they have to wear a badge? Do visitors have to sign in and wear badges? Workstation use. How do people behave at their workstation? This is where you would tell them whether you want them to log off or not. Workstation security. This is where you have physical barriers to sitting down at that workstation. You know, if I steal a user ID and password so I could use it to get improper access, but I can't sit down at the workstation where that user ID is set up for, you have prevented a breach. Physical security can be very cost effective. And also, how do you keep an unauthorized person from seeing what's on the screen? There's commercially available hoods that come out that the person sort of has to sit down up and under to see what's on the screen, so a passerby walking by couldn't see it. There's these weird screens you slap over a screen that you got to be at just the right angle to read it, or you just simply relocate the screen maybe to the other side of the desk so the client sitting down there can't see what's on it. Reasonable, cost-effective security measures. Device and media controls. This is, do you have a handle on who's using what devices? Do you allow your workforce to use their personal computer? HIPAA doesn't say they can't, but if they do, you've got to have a handle on it, and they should sign a statement saying they understand that the use of that personal computer brings it within the coverage of all your HIPAA policies. Do you have a handle on what data is on flash memory or portable hard drives? Technical safeguards. Again, only a few of them compared to the administrative. The first one's quite simple. All it is how do you technically limit access? We've already talked about how do you physically limit it in the physical security. Lock the door to the room where the workstation is. Now this is how do you technically do it. And HIPAA is technically neutral. They don't care if it's user ID and password. They don't care how many characters the password is. I certainly have recommendations along that line. I think 8 or 9 is kind of as few as I'd want to have. You get up to 13 or 14, it's kind of getting hard to remember, and then you have the increased risk of somebody writing the password down on a yellow sticky and sticking it under the keyboard. There was just a doctor in San Francisco sued for $100 million. He had his desktop at home with all his patient records on it encrypted. But he taped the encryption key to the top of the computer, and a burglar stole the computer. And California law is you can get $2,000 in damages even if you suffer no damage for a breach of health information. And there were tens of thousands of patients' data on there. So some aggressive class action lawyer filed a class action saying $2,000 each, that comes to $100 million, and I can get a third of it if I file this lawsuit. So he didn't have too good of password systems. Retinal scan, thumbprint reader, again, they don't care. Use some way that only the person who should be logging on can. And then audit control is how do you technically do that audit we talked about back in the administrative safeguards, the information system activity review. And it again is technologically neutral. They don't care how you do that audit. They don't care if your system has a built-in audit capacity. They don't care if you got to go out and buy auditing software. They don't care if you have to do a hard copy printout and go down and audit it. Use some way of doing the required information system activity review. Person or entity authentication ties back into the access control. It's broader than clinical authentication. In clinical authentication, the doctor or other clinician takes responsibility for the entry in the medical record. The order or the diagnosis or whatever is documented in the chart, the clinician authenticates it. That is a part of this, but this is broader. This is HIPAA authentication. Do we know who did anything? Do we know who tried to access the electronic data? Do we know who did access it? Do we know who manipulated it by adding a new entry or correcting an incorrect entry? I kind of skipped over integrity. Integrity is how do you technically keep your data accurate. Some of you may be aware of how you correct a paper record. You draw a line through it, leaving it still legible, initial it, and date and sign it. For HIPAA, you got to do the electronic version of that. Once the record has been signed, it cannot be changed in a way that destroys the original incorrect entry. Most often, the electronic records will flag it as an error and generate a new field, an addendum with the correction. And then transmission security gets back to that protecting data in motion so that nobody can improperly access it or tamper with it while it's floating through cyberspace. They don't particularly care how you do that. You can do it with a virtual private network. You can do it by encrypting the data while it's being transmitted, but just some way of making certain that an unauthorized person cannot mess with your data while it's going through cyberspace. Then the documentation requirements. So you got to have all these policies. You got to have all the required ones, and you have to have the addressable ones that's reasonable and appropriate for you to have. You don't have to have the addressable policies that are not reasonable and appropriate, though, again, you've got to write down why it isn't reasonable and appropriate. And then, in my opinion, since they fined Massachusetts General $1 million for not having a work-at-home policy, even though HIPAA nowhere mentions work-at-home, much less a work-at-home policy, if you're doing something with health information, such as, let's say, telemedicine, then you've got to say, well, telemedicine isn't mentioned in HIPAA, but I'm sending health information over the internet to another state where we're going to consult by telemedicine. So I might need a policy on how that's handled. the single biggest breach in telemedicine, and I know you guys probably aren't doing that, but just by way of example, is leaving the last patient's data up on the screen when you're starting the next patient's telemedicine consultation. So the second patient is now seeing the first patient's data. Now you can change your policies and procedures at any time as long as you document the change and you keep them compliant. They still follow the requirements of HIPAA. You have to retain all documentation of HIPAA for 6 years from the date of its creation or the date that it was last in effect, whichever is later. I've never quite figured out what they meant by that. I don't know how you could create it later than it was last in effect. But anyway, for a policy, you keep it until it goes out of effect 6 years after that, or you keep the old version for 6 years after you've changed it. You keep your training records for 6 years. You keep your security incident reports for 6 years. All evidence of HIPAA compliance for 6 years. That has nothing to do with any other non-HIPAA retention period. If you guys are providing health care, New York law would tell you how long you need to keep medical records. This has nothing to do with that. If there's some kind of law on how long you keep business records, HIPAA has nothing to do with that. Now, one good thing that came out of the omnibus rule is they defined a breach. And a breach is the unauthorized acquisition, access, use, or disclosure of protected health information that compromises its security, privacy, or integrity. And again, integrity is just that the data is accurate and you can access it when you need it. But what's more helpful is they defined what isn't a breach. An unintentional acquisition, access, use, or disclosure by an employee or agent, such as a volunteer, of the covered entity or business associate, if done in good faith and within the scope of employment, and as I indicated earlier, it wasn't further acquired, access, used, or disclosed. So again, my example, you send the fax to the wrong office. They call you up and say, hey, we got this fax by mistake, and unless you tell us not to, we're going to shred it. That then would not be a breach. It was done accidentally in good faith within the scope of employment, and you verified that it's not going to be further disclosed. Now, I would go a step further, and I would ask them to email me a statement, yes, we did shred it. And then I would add that to the security incident report, and if you're ever audited or hassled, you're covered. You pull up the wrong client's information by mistake. My name is John Tomes, and you want to pull up my data, but you accidentally pull up John Thomas's data. That would not be a breach unless you do something improper with John Thomas's data, like use it to try and commit identity theft or something. So I think this further definition of what a breach isn't is going to be helpful to covered entities and business associates and make them not quite so paranoid that everything is a HIPAA violation that we've got to do something major about. We thought it might be helpful to give some examples of breaches. And there are really breaches and breaches. There is a breach of a policy that does not result in a breach of confidentiality, data integrity, or any other harm. Forgetting to log off where no unauthorized person viewed what was on the screen would be a breach of a HIPAA policy if your workstation use policy says you must log off when you leave the workstation. But as you can see from the last slide, that would not be a HIPAA breach. It's a breach of a policy. A breach of a HIPAA policy that does result in a breach of confidentiality. Let's say you have a Facebook policy, and it says no posting client pictures without the client's signed authorization and a model's release. And your workforce member does that. So that now is a breach of confidentiality, because think of all the unauthorized people that can view what's on Facebook. There is a doctor recently in Pennsylvania, and she was dumb enough to post on Facebook how stupid her patient was. Now, she didn't use the patient's name, so she thought it was okay, but HIPAA protects way more than just your name. And what she did was tell what diagnosis the patient had, which is a very rare diagnosis, and what treatment she performed, which is very unusual, so everybody knew who she was talking about. So her hospital fired her, and her licensure authority fined her $100,000. But even if that wasn't a HIPAA violation, which it was, how stupid is it to badmouth your patients or clients on Facebook? That's hardly going to attract new clients. Breach of a security measure other than a policy. You leave paper records on the subway just secured with a rubber band, like happened with the Massachusetts General $1 million subway ride. Maybe you didn't have a policy on how to transport paper records. But your workforce is supposed to be bright enough to keep them in a locked container when they're taking them outside of the facility. So that then would be a breach of a security measure that is not a breach of a policy. And if it's not recovered, then that's also going to be a breach of confidentiality. Writing your password on a yellow sticky and sticking it on the screen or under the keyboard would be a breach. The next one, I think, happens a lot, and not necessarily with your organization, but a lot of people come home and tell their significant other about the funny thing that happened at work. And they may say the name of the patient or otherwise identify him. There's a nurse in Little Rock, Arkansas, who got a federal felony conviction because she came home and told her husband some dirt about a patient. And she might have got away with it, but her dumb husband then called the patient and threatened to use that information against her in a lawsuit. This did not amuse the patient, and she contacted law enforcement, and now that nurse has a federal felony conviction. Losing your non-password protected cell phone with messages containing sensitive information recorded that were not deleted would be another example of a breach. So what should you do to handle a breach? Well, every organization that has protected health information should develop a report and response policy, which tells people what to do. But if you boil them down, this would be what they'd say, and this is probably a little easier to remember when you're out in the field and you don't have the policy with you, and you still want to do what's right. First, take immediate action to contain the breach. Keep it from getting any worse. There was this case that I mentioned where the organization was not punished because they'd properly trained that employee who committed identity theft. Well, the minute they got the word that he may have committed identity theft, they canceled his password, and they gave him a letter barring him from setting foot on the premises. He couldn't even step on the sidewalk. That was taking immediate action to contain the breach, to keep him from doing any more of it. And they also would have contacted law enforcement to help contain the breach, except they learned about it from law enforcement. The victim had already contacted law enforcement. That's how they learned that it was the perpetrator. But that's containing the breach. Try and keep them from doing any more of it. Report it promptly per the report and response policy. And if you don't remember exactly how to do that, report it to your immediate supervisor and or the HIPAA security officer. It's more important to report it immediately than it is to actually get the exact right report form to fill out. You can always go back and fill out the form later, but get the word out. Then whoever gets the report, usually the security officer, should conduct a thorough investigation and take any further action necessary to contain the breach. Maybe the security officer could think of something else that would keep it from mushrooming, from getting worse. Take any action to mitigate the harm of the breach. Both the security rule and the privacy rule have what we call a duty to mitigate. Mitigate means to lessen the harm of a breach. For example, let's say you lose a document that has all sorts of information that could be used to commit identity theft against one of your clients. Notifying the client so they could be on guard against identity theft would be a way to mitigate. You could even buy them credit reports for a year so that they're going to get outside monitoring of unusual activity. And I'm not saying you got to do that. You decide whether that's necessary or not. Or you could go ahead and buy them LifeLock or some other identity theft insurance for a year. And again, I'm not saying you got to do that. But if it's a very serious risk of identity theft, spending under $100 to get identity theft insurance may be very cost effective if you think, well, if he suffers a major identity theft and I get sued, maybe $100 to prevent any identity theft damage would be very cost effective. Yeah, this is really just kind of gets down to business. That's a business decision. Do we want to spend $100 to possibly prevent, because it may never happen, but possibly prevent a six-figure damage award in a lawsuit or a fine by Health and Human Services? Because as we'll see, the biggest fine is for a HIPAA violation that you don't correct properly. And properly mitigating is one of the things you got to do to correct it. And then the final thing in handling breaches is recommend remedial or disciplinary action as appropriate. Hey, we had this breach. I think we need to tighten up our access policy. It was too easy for this person to do this. I think we need to take disciplinary action. This person has not been very cognizant of following policy. They've had some prior breaches. Our reprimanding them didn't get their attention. And this was a fairly serious breach. I think we need to suspend them for a week without pay. And that's just an example. You know, you may not have the ability to suspend somebody without pay. That may have to go through human resources or whatever, but the security officer or privacy officer, whoever is investigating it, ought to at least make the recommendation. And don't forget to document in the security incident report all these things that happened as a result of the breach. Now here's the HITECH Act changes regarding business associates. They now face the same civil and criminal liability as do covered entities. Before the HITECH Act, the business associate only had to agree by contract to have reasonable and appropriate security measures on the data that they receive and are supposed to do something with. Now they've got to, by law, follow the whole security rule. And if they don't, they face the same criminal and civil liability as do covered entities. They now, by law, and I'm jumping around here, but I'm trying to do this in a sense that makes sense, got to follow the privacy rule, where before the HITECH Act, they only had to agree to do whatever with patient privacy the contract told them to do. Well, now by law, they got to follow it, so they face legal liability if they don't. They can be audited by the Office of the Inspector General of Health and Human Services, the same as covered entities can be audited. Got to notify the covered entity of a breach. That isn't really a change. Always had to do that, but only by contract, not by law, and be able to provide an accounting of disclosures. That's not a huge change. It's just now by law, not just by contract. So in my opinion, even though Health and Human Services says otherwise, business associates are effectively, if not legally, covered entities. They weren't added to the list of covered entities, so they're not legally covered entities, but they got to do everything a covered entity does, just about, and they face the same liability. So I think they're kind of effectively covered entities. The omnibus rule extended this further, and they said that now subcontractors of business associates are business associates. So they then face all the same liability and have to do all the things that are on the previous slide. So under the omnibus rule, a subcontractor that creates, receives, maintains, or transmits protected health information for what I call the upstream business associate, the one that's hired them, they're business associates too. The downstream business associate is a business associate of the upstream business associate, who is a business associate of another upstream business associate, or the covered entity. I mean, I could see this going down 3 or 4 layers. Let's say you hired me to represent you in some legal matter. I would then be your downstream business associate. If I had to hire an expert witness to win the case, that expert witness would be my downstream business associate. And if my expert witness hired a shredding company to shred the documents when the case is over, that would be his downstream business associate. So right there, we've got 4 downstream business associates. So there's really no limit on how many of these we could have. The good news is you only have to get the downstream business associate contract with the one immediately below you. You don't have to get them all these layers down. Now, before the HITECH Act, you were not liable for the breach of a downstream business associate if you had actual knowledge of the breach. Unless you had actual knowledge of the breach and you didn't do anything about it. So really, you weren't going to be liable for the business associate's breach very often. You'd have to know about it and ignore it to be liable. And of course, you wouldn't ignore it. You'd try to mitigate it. You'd try and make sure it didn't happen again. You might even fire the business associate. Now, you're liable for downstream business associates in accordance with the federal common law of agency, whether you've got a business associate contract in place or not. And this is a fairly tricky legal area. But the best way to understand it is if you exert too much control over how the business associate does their work for you, then they're your agent and you're liable for their breaches. For example, if you hire a shredding service, your contract should simply say that you are hiring them to shred your documents in a manner that protects confidentiality. You shouldn't say, we're hiring you to shred our documents using a Recode 1200 model crossband shredder or similar shredder approved by the security officer, because now you're doing too much control of how they're doing the shredding. And that makes them your agent, and then you're liable if instead of shredding, they throw the documents you should have shredded out into a dumpster. Now, HIPAA initially just had one type of breach that could lead to a fine. In the omnibus rule, they added a second type of breach, and that is when the breach was due to a reasonable cause and not to willful neglect. And at first, they just defined reasonable cause as anything that wasn't willful neglect, which wasn't really all that helpful. Willful neglect is where you didn't do something that HIPAA requires. If the security rule requires a written risk analysis. If you didn't do one and that caused a breach, then that would be willful neglect, which is the top two tiers with the heaviest. They call them civil money penalties. It's just another term for a fine. So they did in the omnibus rule define reasonable cause. An act or omission in which the covered entity or business associate knew or by exercising reasonable diligence would have known that the act violated HIPAA, but where they didn't act with willful neglect. This includes violations where it would be unreasonable for you to comply with that administrative simplification program. Let's say that it's going to cost you $100,000 to put in a new firewall and you don't have it. There's no way you can get it. Well, then that falls into the reasonable cause category. You knew you're supposed to get one. You tried to find the money in the budget, but you couldn't. Then that would not kick you up into the willful neglect area where you get the real heavy fines. Risk analysis. I already said that having a written risk analysis and enforcing your policies through the sanction policy are the two most important things to do. Of the fines that have been imposed so far, ranging from $50,000 to $4.3 million, well over 2/3 of them involved not having done a written risk analysis. In fact, in one case, Blue Cross Blue Shield of Tennessee was a $1.5 million fine for not updating their risk analysis. So it's very important. And even if there was no fine for it, you're supposed to implement reasonable and appropriate security measures. And without doing a risk analysis, you're just guessing. at what security measure to implement. How do you do it? This isn't necessarily the only way to do it, but it is a very good way. I've taken over 1,000 covered entities and business associates through this process using this methodology, and knock on wood, we have yet to have had any breaches. So it seems to be working. Get a good team together. You want various disciplines. If you've got some computer nerd, well, they're going to be able to help you with the technical risks. You got some financial guru. They could help you with the financial aspect of the risk. Maybe human resources to help you with the human risks. Maybe a lawyer to help you with the legal risks, or a paralegal. But sometimes you get stuck doing this all by yourself. The boss says, hey, I don't want to bother all these other people, you just do it. And you can do it if you look at the list of who should be on the team and mentally put yourself in those disciplines. So you can think of, well, what are the clinical risks, if any? What are the financial risks, if any? What are the technical risks, if any? What are the human risks, if any? Identify assets. What data do you have that you have to protect? And that doesn't mean you have to list every client's data by name or client number, but you have to list every category and where it is maintained. Where are the paper records maintained? Where are the electronic records maintained? Are they on your server? Do you store them in the cloud? They're hosted remotely by Microsoft or Google or somebody. Do you have them backed up on disks in a bank vault? What? Then to the extent that you are automated, your data resides in a system, and you cannot protect the data in the system unless you protect all the components of the system. Computer security experts call that protecting the perimeter. And if one of your workforce members has a Wi-Fi enabled laptop that you don't know about, and it's merely accessing your system remotely, and there's no firewall on that laptop, maybe that's just exposed your whole system. But you can't get it within the system unless you identify that it's a part of the system. And then you either prohibit its use or you make that person get a firewall on it. Determine the risks to those assets, and then quantify the risk. How likely is it to happen, and how harmful will it be if it does happen? So that you're focusing your presumably limited resources where they're going to do the most good, where the event is likely to happen, and where it will be harmful if it does happen. I wouldn't waste much money on something that's never going to happen, and if it does, who cares? I'd say these are the big risks that could happen and could hurt, and that's where we're going to put our resources. And then you select reasonable, cost-effective security measures to guard against those serious risks by balancing the cost of the security measure against the cost of the harm that would occur if that security measure didn't prevent the breach. Now, that doesn't mean if you've decided that the harm is going to cost $10,000, that you got to spend $10,000. You may not have to spend any money at all. You may be able to handle the risk through policies. But what it means is if the harm is $10,000, you don't have to spend $3 million to guard against it. I always use the example, we had a client that we took through risk analysis of lost or stolen laptops out in the field. It was a home health agency Each nurse took a laptop out in the field, and we evaluated that it was a high probability that they were going to lose some or have them stolen, because they were averaging 5 lost or stolen laptops a year. So that to me indicated there was about a 100% chance they're going to lose at least one more sooner or later, and probably they'll keep losing about 5 a year. The harm was only about 10,000 a year that they'd actually experienced. But we thought that there was a chance for way huger harm, like the $1 million subway ride fine. And just because they'd kind of been lucky and skated didn't mean that there wasn't a possibility for something way worse than the 10,000 a year in harm that they'd been experiencing from those lost laptops. So we wrote this up as solid 10,000 with an asterisk that we then explained the asterisk how all the ways that it could be much worse harm. So we decided that it was high and high. And now we got to balance the cost of security measures against 10,000 with an asterisk. And the first suggestion anybody made was, let's send an armed guard with every nurse. Well, assuming you could get an armed guard at 30,000 a year, probably couldn't, but that's still $3 million. You're going to guard against the $10,000 harm by spending $3 million? I don't think so. Even if the asterisk is $1 million hit a year, you're not going to stay in business very long spending $3 million to avoid it. So we didn't do that. What we ended up doing was spending $1,000 for locking cables and writing a portable computer policy and enforcing it. And we cut the 5 a year lost. Since then, they only lost 1. But that's an example. We're not going to spend $3 million to guard against a solid 10,000 with the possibility of something worse. Then test and revise your security measures. I'm happy to tell you that over 90% of the risk analyses I've taken people through, we spent no money. We controlled the risks by enforcing standards. HIPAA calls these things all sorts of things. They want a sanction policy. They want a termination procedure. They want a backup plan. Well, they're all just really policies. And it's not that important what you call them. It's how do you write them. They can't be some vague commitment to some inchoate goal. For example, a password policy that would not be HIPAA compliant would say, it is our policy to only have secure passwords. What does that tell anybody? Every member of your workforce capable of coming up with a secure password on their own. Now I'm going to give you a compliant one. And I'm not saying it is perfect. We don't have to be perfect. We only have to have reasonable and appropriate security measures. All passwords must be at least 9 characters in length. Must be alphanumeric. Must have 1 special character. And in no circumstance will comprise the data user's nickname, pet name, social security number, or similar term. See the difference in specificity? And the next sentence might well say, nor will the data user write his or her password on a yellow sticky and stick it on the screen or under the keyboard. If they've been doing it, they're going to keep doing it unless you prohibit it in a policy and enforce it. Here's some of the ones that are required. Sanction policies required by both security and privacy. Security requires a backup plan for your electronic health information, et cetera, et cetera. Privacy requires some policies, both expressly, like the sanction policy, and impliedly. They don't say you got to have it, but if you do that activity, as I said earlier, you're going to want to think, do I need a policy? I might want to have an alternate communication policy. HIPAA mentions alternate communications, but doesn't say that you got to afford that right, but it doesn't say you got to have a policy on how to do it. But since a New York jury gave $300,000 to Long Island Surgery Center as an exemplary damage award, maybe they should have had a policy. And maybe you need one. Okay, I've already mentioned the fine first. Before the HITECH Act was only 100 if you didn't comply with the security standards. Now that 100 goes up to 1,000 for violations due to a reasonable cause and not to willful neglect. And we had our slide a little ways back with the new definition of reasonable cause. Now this is capped at $100,000 for all identical violations in any one calendar year. If it is due to willful neglect, it goes up to $10,000 if you correct it properly, and capped at $250,000. And that's why that report and response procedure, what you do when you suspect or detect a breach, is so important, because that's how you correct it properly. And if you don't correct it properly, it goes up to $50,000 for each violation, with a cap of $1.5 million. What is a little scary about this, if you lose a memory stick with 100 clients' data on it, Health and Human Services says that is not one breach. Loss of a device containing protected health information. It is a separate breach when it comes to calculating the fines for each client's data on that memory stick. So that's how you can get up to these penalties of $1.5 million for CVS Pharmacy. Actually, they were $2.25 million. How did they get past the 1.5 cap? Health and Human Services said those weren't identical breaches. They were bottle breaches with the label still on, and they were pieces of paper breaches. To me, it was all the same breach because it was the same data on the prescription as on the prescription label, but they said no, that's two different types of breach. Here's the factors they look at when trying to decide whether to impose a financial penalty or not: the nature and extent of the violation, the harm that results, your history of compliance. In other words, if you had a bunch of violations before, that's going to work to your disadvantage. They will look at your financial condition. They're probably not going to hit a very small practice or a nonprofit with some of these huge million-dollar fines, and any other matters that justice may require. Here's a list of the civil sanctions. I mentioned the CVS Pharmacy. They threw the prescription bottles and the prescriptions into a dumpster. Rite Aid did the same thing, but they didn't throw as many away, so they only got hit with $1 million. Providence Health, $100,000 fine, and implement a corrective action plan, which they have to pay an auditing firm to come and audit their compliance with it. They lost laptops and backup media. We already talked about the Massachusetts General $1 million subway ride. Signet Health is the biggest fine so far, $4.3 million. They refused to give 41 patients copies of their data, and then when the patients complained to Health and Human Services, they obstructed the Health and Human Services investigation. A perfect example of how not to respond to a breach. Phoenix, UCLA Health System, we already talked about. They fined UCLA for what that doctor did that got him the 4 months for looking at Leonardo DiCaprio's chart and Barbara Walters' chart. Phoenix Cardiac Surgery hadn't done a risk analysis, hadn't done enough training or imposed enough policies. Alaska Medicaid, so they're going to go after a government organization. 1.7 for basically the same thing as Phoenix Cardiac Surgery. I'd already mentioned the Massachusetts Ioneer case. 1.5, they didn't update their risk analysis, and they didn't document the addressable implementation specification for potential alternate security measures. And the most recent, Hospice of North Idaho, this was the first fine where there were fewer than 500 individuals involved in the breach. They hadn't done a risk analysis of laptops, and they didn't have any policies about protecting mobile devices. Civil litigation. Before the HITECH Act, you could not be sued in federal court. The HITECH Act added a new federal lawsuit, but the client can't sue you themselves or get an attorney to sue you. They have to get the state attorney general to do that, and that's to keep out frivolous lawsuits. We've already had some of these cases. The Connecticut Attorney General got a $250,000 settlement. Minnesota Attorney General has sued a business associate. Remember, they now face the same civil and criminal liabilities do covered entities. And I already mentioned, although it was brought under state law, not HIPAA, that case where the punitive or exemplary damages were awarded against Long Island Surgery Center for calling it home after being asked not to. Now, all of this may seem pretty threatening, but I've taken 1,000 clients through this, and we haven't had any of these hassles occur. It's largely just common sense. And if you don't know what to do, you know, there's my email. You can always ask me. You can ask the privacy officer up here. They have frequently asked questions on the Health and Human Services website that gives quite a bit of guidance. And I guess we're ready to throw it open for questions.
Thank you, John. So we're gonna look to see if anybody has sent us some questions. But so before we close at least this part of the webinar, I want to encourage you to share this information. The PowerPoint, you know, is going to be recorded. So we really think it's important that you share it with people in your organization that should be involved based on all the content of the presentation. So share it definitely with your ED, the people who handle the data, and anybody who's somehow connected to data, to chat data. I'm sorry, to clients information regarding chat clients. Or chat work. And later on, so as I said, we have John's information if you want to contact him. And later on, we're going to also be sending you some tools that you could use to start taking steps towards the risk analysis that John mentioned. So if you're interested in getting that, let us know, but we will be sending something soon.